What's up, everybody? Christian James here. Today's video, the World Health Organization has approved an extra 38 vaccines to stab us and jab us with. Let's take a look.
Health Organization just put out a brand new press release bragging about how they've teamed up with the World Trade Organization and the World Customs Organization to create 38 brand new custom codes for
Okay.
human vaccines, plus face masks, PPE, and ambulances.
Oh shit, here we go again.
Under the guise of strengthening emergency preparedness, the World Health Organization's 38 brand new codes will enter the International Harmonized Commodity Description and Coding System in January of 2028. It sounds like boring technical trade stuff, but in actuality, it seems like a direct hit to the United States and their trade partnerships, which has just officially pulled out of the World Health Organization, funding and all.
Good, Trump, good.
Now, this is the private interest corporate entity, don't forget, and they wouldn't do anything small or anything that doesn't give them or their pharmaceutical partners more power, more tracking, more control. They say that this will make it easier to track vaccine and medical product shipments worldwide and allow for faster, more coordinated responses during future health emergencies.
If there weren't so many weak, fat pieces of garbage all over the world.
That's right, I said it.
We wouldn't have had the COVID lockdown because there would have been more than like 5 people in every city with a pair of testicles.
That are so fucking tiny and shriveled up. Let me know, because I'll put them right back up his screen.
All right? If they're doing it again, it's because all you fucking Muppets who took it the first time didn't learn. So your Muppet children are going to be the next ones on board to take it. Give me a friggin' break.
But don't be fooled. This is a global surveillance grid for things like vaccines. Every dose, every batch, every border crossing is logged, categorized, and monitored in real time. And who gets the data? Well, it's right back to the WHO, of course. They openly admit they're using their MI4A platform. That stands for Market Information for Access peer system, which pulls data straight from member states or countries. So governments hand over their vaccine trade numbers, expected volumes, which diseases are vital to jab for.
How did human beings, how did all of our relatives make it all the way to now? Hospitals, ambulances, all this, all that. But somehow, with the most amount of safety, the most amount of health, the most amount of cleanliness, showers daily, you know what I mean? Washing your hands, changing your drawers, doing laundry, all that crap. And yet we're sicker than, God, the weak are ruining the world.
And suddenly, the WHO has an even clearer picture of every country's immunization program, stockpiles, and gaps. MI4A is essentially the WHO's centralized vaccine market intelligence system, built on country-reported purchasing data enriched by manufacturer input and turned into public datasets, reports, and studies that shape global vaccine policy, pricing discussions, and access strategies. So while equitable access is the marketing line, this is more about data solicitation on a global scale. They want to know exactly where the resistance is,
Right here, okay? You see it? This guy? Here. Definitely here. Hopefully fucking there too. Right here.
The uptake is low, where people are saying no.
Right here.
And once they have that granular trade data aligned with tariffs and emergency expedited procedures, they can pressure countries even harder, especially ones falling behind on things like vaccination targets.
Don't worry, I live where there's fucking elbows up. That Muppet ain't pressuring nobody to do nothing.
They say
that motherfucker could not get you to upsize your fries if he worked at McDonald's, but somebody's in charge of the country. Fucking Muppets.
So outright, improve access to global vaccine trade data, enhancing transparency and working towards WHO's long-term mission of equitable access to vaccines worldwide. Now, after the last few years, equitable access is just Orwellian doublespeak for mandatory campaigns, digital passports, and behaviorally informed coercion dressed up as public health goals.
This is because of weak people. If you took it and you took 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 follow-up shots, this on you.
Public health world often make the mistake of thinking that science and evidence alone are enough to convince the public and policymakers to follow our advice.
Fuck you and your advice.
How often we are proved wrong. The COVID-19 pandemic has been a powerful demonstration
of how weak the average person is. 2 weeks to flatten the curve. And then they bribed you with, hey, you can win a lottery. Do you want a donut? Kids, you want some candy and ice cream? To take a shot. Only time in human history somebody's ever tried to bribe me to take something. Seems equitable to me. Seems, the way things should be. Seems like a lawfully run government. Because those of us who didn't want it clearly must be pressured more and more and more until it turned out that those of us who didn't take it had no fucking problems.
Of the need to engage communities, understand their concerns and motivations, and adapt strategies accordingly. Governments have had to persuade their populations to accept new behaviors and conditions, all in the context of rapidly evolving evidence.
Yeah.
As part of our transformation, we created a new unit for behavioral sciences to integrate.
So essentially, if you don't want something, they're going to find a way to make you want it. Okay? First it's going to be coercion, and then it's going to be some form of psychosis, likely. Some form to get everybody to do everything they're supposed to do. And if that doesn't work, the last step is always force.
About why people make the decisions they do into our programs.
Because we don't want it.
Work.
That's easy, dummy.
The idea came from
all
Dr.
that education,
Elena
no goddamn
Altieri.
sense.
Where is Elena? She here? Can you stand up so people can see you?
Why? Look at the camera. Let's see your face. No,
in response, the idea came from Dr. Elena Altieri in response to my invitation to all staff to propose crazy ideas to make our organization more effective and efficient.
Yeah, I love also how she never looked even closely at the camera. Her hair was covering her face the whole time.
And now they have the customs backbone to make it all happen. Remember how the WHO helped ram through experimental mRNA shots as essential during the last emergency? How they downplayed injuries, silenced questions, and pushed these products on kids with zero long-term data? Now they're quietly building the infrastructure to do it again. But this time, smoother, quicker, with better tracking so no country can quietly opt out or slow walk the next rollout. They're doing it under the guise of not leaving them behind. It's emergency preparedness, all right, with permanent pandemic infrastructure. 38 new codes just for vaccines and related gear isn't a minor update, but rather it seems like it's laying the track for the next global injection campaign.
You got it. You got it. That's all it is, right? Okay, so before we didn't have a real list. Like clearly you brought your health card and kids brought their report card and you got shot. So to some degree there would be a list. But the list they have now is a list of us who didn't take it the first time or wear the stupid mask no matter how hard you try and how much you fucking yelled at me.
The serious challenge that's posed by anti-vaxxers.
Not anti-vaccines. No. Polio vaccine's a real vaccine. That one works. This is bullshit.
And I think we need to strategize to really push back because vaccines work. Vaccines affect adults. And we have...
Oh, that's good reason. Vaccines works. Vaccines affect adults. That's solid science and a good way to convince me, you fucking muppet.
Science, evidence on our side.
No, you don't.
I think...
You definitely don't.
It's time to be more aggressive in pushing back on anti-vaxxers.
Yeah, try.
I think they use COVID as an opportunity and, all the havoc they're creating.
I'm sorry. All I heard was blah, blah, blah. I'm a dirty tramp.
What havoc? The fact that we said no? That's a lot of havoc. No. Thank you. Look at the havoc.
Maybe that's one of the messages also I would like to include to whatever I have said. And thank you to all panelists, and thank you also to all
The havoc we're causing. Go fuck yourself.
colleagues, partners who have joined today, and look forward to continue to work with you to save children, to save lives.
And the timing is noticeable because this will work alongside the WHO's new pandemic treaty and international health regulation amendments, giving them more authority over national health decisions. Coincidence? I think not. This is why informed choice matters more than ever. They want every vaccine shipment digitized and tracked so that they can monitor compliance like never before. They want the data, your country's data, your family's choices. Informed choice, though, isn't negotiable, no matter how many fancy new codes they invent. For Rebel News, I'm Tamara.
So this time we can see it coming. This time you can see that they're coming to stab you, your children, everybody, put everybody in lockdown, do all the bullshit they did before under the guise of care, but it's to really make profit, to make it rain. Look, do what you want to do, but understand an informed choice is you actually using this and not panicking with this to take this. All right? Use a little more of this. We all understand how hard people were pressured, and we all know somebody that at least knows somebody that knows somebody who got hurt from it. I know multiple people. I'm a trainer. I'm a coach. I see people all the time. My first client to take it the next day, she had a serious lady issue, and I'm not going to go into it, but the first person I know take it has a severe issue, goes to the hospital, sees a doctor, sees a specialist, and they blame it on me because I upped their calories in our training. Ludicrous. But hey, no one ever wants to admit when they're fucking wrong because that's how you get sued. But 28, 38, 48 new codes, whatever the hell's going on out there, we don't need those new codes. You don't need no more of that. You need to take your ass to the gym. You need to get 6 to 8 hours of sleep. You need to take your vitamins, say your prayers, do all that bullshit. You need to take care of yourself the way people have always taken care of themselves. From the inside out, not the outside in. Yeah, if you got something that at the end of the day you need some help with due to modern science, modern medicine, take it. If you don't really need it, don't take it. If you don't have a headache, you don't take a fucking Tylenol. If you don't have a bad immune system, don't take something they're telling you is good for your immune system if you have a good immune system. Nobody gets a tune-up for the car when the car is running well. Like, comment, subscribe. Tell me I'm right. Tell me I'm wrong. Tell me you agree. Tell me you disagree. Tell me something in the comment section. Thank you very much for watching. Be careful out there. I'm out.